Welcome to the GSMC Fitness Podcast, the show that helps you sort through all of the trends, new and old, of the fitness world. We'll talk about yoga, running, Zumba, weightlifting, and everything in between. Whether you've got your fitness routine down to a science or you're just starting out and looking for direction, you'll find educational and entertaining information on the GSMC Fitness Podcast.
What's up, guys, and welcome to GSMC Fitness Podcast, brought to you by the GSMC Podcast Network. I am your host, Cynthia, and happy Wednesday, everyone. I hope we're all doing great, hanging in there, doing okay. I know there's a lot of chaos happening in the world right now with all the protests, and I just hope that you guys are all, if you are protesting, please be safe and protect one another, look out for one another, love one another. And that's why I don't really know how to start off today's podcast, just because it has been a lot of crazy things going on, and like I can't just like hop on here and be like extremely cheery and bubbly and happy. I got to keep it real and authentic for you guys, because that's the only way to do it, right? And I don't know how I'm feeling. There's a lot of emotions, a lot of things happening, and I'm just trying to like stay calm and stay collected. I kind of find myself going back and forth between, you know, it's been hard for me to disconnect. I don't know how any of you guys are feeling, but it's been hard for me to disconnect from social media, my phone. I'm stuck in a place. I feel like I need to stay on my phone so I can stay informed. But then I'm like, I need to shy away from my phone, because I know it's not good for me to constantly be checking up on these things 24/7. It's not good for my mental health. It just causes even more extreme worry and anxiety and stress. And yeah, so that's kind of how I've been in right now. But I have started reading this great book. It's actually a book of poems called Love is Life. Living on valued energy is surely love in full effect. That is what the book stands for. Love is Life. It's an acronym by Dr. Chill. Dr. Chill happens to be Jhené Aiko's dad. For those of you who are unaware of who Jhené Aiko is, she is an amazing and very popular R&B soul singer. And I've been jamming with her for a minute. So I was like, it just makes sense to pick up this book. They're both very into spiritual enlightenment. So am I. It may not be for everybody, but it's helped me tremendously during these times to just kind of like relax my mind, relax my body. It's helped me to disconnect from all of the craziness that's going on right now. And yeah, that's basically it. An update for you guys. I hope that you guys are hanging in there as well. And, you know, just make sure your mental health is A-okay. Well, it's kind of hard. I mean, we've gone through a lot in 2020, and we're not even halfway through, you know, between COVID. And for one moment, we were listening about like very deadly hornets. I don't know. It's a movie, and it's a horror movie going on right now. So I just hope you guys are all hanging in there and being, you know, staying safe. And that is not what we're here to talk about. We're here to talk about myofascial rolling, aka foam rolling. So I kind of wanted to continue the conversation from last week. We talked about a warm-up, cool-down, basically the warm-up phase and the cool-down phase. And I believe that myofascial rolling or foam rolling serves a very important aspect into training and into the warm-up and cool-down phases. So I'll be using those two terms interchangeably, myofascial rolling and foam rolling. So don't get confused if like in one sentence I say myofascial rolling, and then the next I say foam rolling. And let's keep a track of how many times I say those two terms, because I feel like we're barely 5 minutes into the podcast and I probably already said those two things like 6 times. So the first phase in the corrective exercise continuum is to inhibit or modulate activity of the nervous system that innervates the myofascial. One of the most common myofascial techniques used to inhibit is myofascial rolling, or often called self-myofascial release. This technique uses various tools such as a foam roller, roller ball, or a handheld device. So what exactly is self-myofascial release? It's a flexibility technique used to inhibit overactive muscle fibers. And myofascial rolling is a compression intervention where an external object, such as a foam roller, compresses the myofascial. And myofascial rolling can be used for 2 primary reasons. First one being to affect local myofascial tissue dysfunction. The second, to influence the autonomic nervous system. This type of intervention has traditionally been called self-myofascial release, which is considered antiquated given the current research. Specifically, the term release may be contrary since the current evidence suggests the direct compression by the object may produce a local mechanical and global neurophysiological response through afferent central nervous system pathways. This is going to get a little bit nerdy, so I hope you guys hang in there with me, okay? For the local mechanical effect, the direct roller pressure may change the viscoelastic properties of the local myofascial by mechanisms such as thixotrophy, which is reduced viscosity, and reducing myofascial restriction, fluid changes, and cellular responses. Researchers have also found that rolling reduces local arterial stiffness, increases arterial tissue perfusion, and improves vascular endothelial function, which are all related to local physiological changes. For the neurophysiological effect, the direct roller pressure may influence tissue relaxation and pain in the local and surrounding tissues. For tissue relaxation, the roller pressure may induce a greater myofascial relaxation or stretch tolerance through central nervous system afferent input from the Golgi tendon reflex, gamma loop modulation, and mechanical receptors. Now, let's get into the application guidelines for self-myofascial interventions. When choosing a myofascial tool, it is important to consider the pressure exerted by the object, which is the result of diameter, density, and force applied. High density and small diameter myofascial rollers can apply a significant amount of pressure to the tissues, possibly resulting in tissue damage. Further, given that myofascial interventions require a degree of relaxation, too much pressure may cause the user to tense up. Fitness professionals should begin clients on a large, soft, textured myofascial tool until they become more accustomed to self-myofascial rolling. Let's talk about pressure. No studies have been published to date that has explored the specific amount of pressure needed for optimal results. The ideal amount of pressure is dependent on the user's experience, pain threshold, and perception. The most practical method of applying pressure is the use of body weight and upper body strength if using a handheld tool such as a stick roller. Density. Density plays a key role in the overall amount of pressure applied to the tissues. Individuals who have never used a myofascial roller should begin with a soft roller. While more dense rollers have frequently been promoted as better because they work deeper layers of tissue, studies have suggested that soft to moderate rollers may achieve better overall results. Medium density myofascial rollers appear to show the best improvements in joint mobility and decrease the perception of pain, followed by mild density myofascial rollers. The findings from this research further suggested that personal preference should be taken into consideration. The most effective myofascial roller is the one the individual will use regularly. Myofascial techniques work to influence the nervous system. Thus, it is imperative that the user be able to breathe and relax while using myofascial techniques. Self-myofascial tools that are too hard may interfere with overall relaxation and reduce the effectiveness of the technique. So the whole point is for you to be relaxed, rolling these knots out. And if you're not relaxed, then it's kind of defeating the purpose of the whole technique. And you guys, we're going to cut into our very first break right now. When we come back, more on application guidelines for self-myofascial interventions.
Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Hey guys, and welcome to GSMC Fitness Podcast. So we're still getting into the different ways or different application guidelines for foam rolling interventions. Next, we're going to be discussing diameter. As surface area is a function of pressure, a smaller diameter elicits more acute pressure and may influence deeper layers of tissue. Conversely, a larger diameter myofascial tool has more surface area, which displaces the pressure more equally across the superficial tissues. Similar to the density of a roller, the diameter of the roller can be progressed over time as needed. Individuals just beginning to use myofascial techniques should begin with a larger diameter roller to become more accustomed to the practice before moving to smaller myofascial rollers. Texture. In a comparison of 3 myofascial rollers, 1 grid pattern, 1 random multi-level surface pattern, and 1 smooth, the 2 textured pattern rolls produce greater immediate effects. The research is not clear why a textured roller produced greater results, but suggests that the textures may distort or move the textures more than a smooth roller, which may stimulate the local receptors and central nervous system differently than a smooth surface roller. Now we're going to be talking about foam rolling intervention tools, the different tools that you can use. They basically all have like the same function. Myofascial balls. These are spherical tools that come in different sizes and densities. They're often called massage balls as well. Myofascial balls will generally elicit more pressure as there is less surface contact area when compared to a myofascial roller of the same diameter and density. Therefore, a myofascial ball may be seen as a progression from the regular myofascial roller. Handheld myofascial rollers. Handheld myofascial rollers are a great alternative to regular myofascial rollers and balls. In most cases, handheld rollers are designed to be held in both hands, thus are limited to the lower extremities. Handheld rollers that are designed for one hand are suitable for the entire body. Handheld rollers are a suitable option for users that are unable to get on the ground to use a traditional roller, whether it is a medical issue or if the user is not comfortable getting on the ground. Further, handheld rollers appear to be as effective as a traditional roller on hamstring flexibility. If the person can't get on the ground, it is recommended to use a cylindrical myofascial roller over a handheld. It is recommended that fitness professionals do not use a handheld roller to apply pressure to their client. The client should always be the one in control of the pressure, as this enhances the safety of the technique and teaches the client to be self-reliant. Vibration. In a study comparing a myofascial roller with vibration to the same roller without vibration, those in the vibration group experienced greater improvements in flexibility and mobility and reduction in the perception of pain. A key takeaway from the current vibration roller research is the influence on the perception of pain. The vibration likely mitigates pain through an effect called vibratory analgesia. Put simply, vibratory analgesia occurs when the vibration stimulates certain mechanoreceptors that temporarily interfere with the sensation of pain. It may be thought of as simply turning the volume down on the pain signal. It is important to note that the effect is temporary. Another perspective to consider is that the vibration will reduce the discomfort associated with myofascial rolling. When addressing more tender areas, such as the IT band, a vibrating roller may be more comfortable, thus the user is likely to stay on the tender area longer, leading to more positive results overall. Next, let's talk about cupping. Cupping is a form of myofascial therapy commonly practiced in Asian and Middle East cultures that has recently become more popular in the United States. Cupping uses suction to help promote movement of blood and other fluids through the tissues. Due to the variability in techniques and methods, it is recommended that the fitness professionals seek out education and check local and state regulations regarding the use of cupping with clients. This one is the one that looks painful. You've probably seen pictures online of like people who do cupping and they have like big, huge red circles on their backs or on their legs. That's what cupping is. Now let's talk about myofascial flossing. This is a method intended to increase flexibility and range of motion. It's also called voodoo flossing or just flossing. Myofascial flossing is performed by teaching the client to wrap a latex band around a body part using a 50% overlap pattern and using a stretch force of 50 to 90%. Once the band is applied, the client then performs up to 2 minutes of active or passive movements to induce tissue flossing. Myofascial flossing has also shown promise as a technique to help speed up recovery by reducing the negative effects of delayed onset muscle soreness, also known as DOMS, and may assist in speeding up recovery from specific injuries such as Achilles tendinopathy. It is important to note that the research methods and outcomes for myofascial flossing are not consistent. Several studies have also indicated there is no measurable improvement in mobility and flexibility or reduction in DOMS. Due to this inconsistency, it is recommended that the fitness professionals seek out education and check the legal requirements regarding the use of myofascial flossing with clients. Next, we have instrument-assisted soft tissue mobilization, also known as IASTM. This is specifically designed instruments to provide a mobilizing effect to scar tissue and myofascial adhesions. The use of instruments is thought to provide the healthcare professional with a mechanical advantage, allowing them to work myofascial tissue both deeper and different than with their hands. Instrument-assisted soft tissue mobilization has been promoted as an effective tool for removing scar tissue and promoting a return to normal function by inducing localized inflammation that restarts the healing process and stimulates connective tissue remolding. The data on instrument-assisted soft tissue mobilization is mixed. However, there is more evidence or some evidence that the technique may improve short-term flexibility and mobility. And those are like the main self-myofascial intervention tools. Again, it is the massage balls or myofascial balls. We have the handheld myofascial rollers. We have vibration, cupping, myofascial flossing, and instrument-assisted soft tissue mobilization. I did not include in this list the cylindrical foam roller because I feel like a lot of us are familiar with the cylindrical foam roller anyway. I feel like that's most people's first encounter with self-myofascial release is using the foam roller. I know that was mine. And I have used like the myofascial massage balls, and those hurt, okay? As we said, the diameter in that ball is a lot smaller than on a cylindrical foam roller, so it hurts. And I've used a handheld myofascial roller as well. That one's really good if you have another person helping. My friend will do it on my hamstring, and those help a lot. I do want to try cupping. I'm kind of scared just from like the pictures I've seen of people doing it. And vibration, I have like a massage gun that I use. It's not the Hypervolt one. The Hypervolt one is very popular. The brand that I use is called Jaku, Jawku, Jaku. And I really like that one. And that one helps more than the cylindrical foam roller. So if you have the budget and if you have the means, invest in a massage gun because those are life-changing. And you guys, we're going to cut into another very brief break right now. When we come back, we'll be discussing precautions and contradictions for self-myofascial rolling.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
What's up, guys, and welcome back to GSMC Fitness Podcast. So we're now moving on to some of the precautions and contradictions for self-myofascial rolling. So again, self-myofascial rolling requires the client to apply body weight pressure on a myofascial roller, which may require the client to lie in different positions, such as on their side, on their back, on their front, etc. Such positions may exacerbate the effects of certain precautions and contradictions. Self-myofascial rolling may produce some discomfort that results in the client holding their breath. If a client has hypertension or high blood pressure, for example, a horizontal position combined with holding their breath may result in a significant spike in blood pressure. Thus, a hyperintensive client may need to perform self-myofascial rolling in a different position, such as seated using a handheld myofascial roller, and be encouraged to concentrate on slow, consistent breathing. If for any reason a client with a precaution is not comfortable performing self-myofascial rolling, the fitness professional should not force them to use any techniques. A precaution means the fitness professional should proceed with extreme caution. Those with precautions can still perform self-myofascial rolling, but may need to modify the position, instead seated instead of lying on the floor or mat. Change the method of self-myofascial rolling using a handheld instead of the traditional foam roller, or avoid certain areas. So the following individuals should be preceded with precaution, and those are people with hypertension, and it must be controlled, diabetes, abnormal sensations such as numbness, inability to position the body or perform myofascial rolling correctly, scoliosis or spinal deformity, osteopenia, varicose veins, sensitivity to pressure, young children, medications, they may alter client sensations, pregnancy, bony prominences or regions, recent injury or surgery, elderly, and fibromyalgia. And I actually have done like the massage gun. My mom has fibromyalgia actually and varicose veins. So we just proceed with immense caution, making sure the pressure is right, not too hard. So these individuals I just listed, if you have any of the following conditions, proceed with caution, extreme caution. Now, a contradiction's different. A contradiction differs from a precaution in that the risk lightly outweigh the benefits. Self-myofascial rolling should not be conducted in the presence of a contradiction in order to ensure client safety. It is important to note that some conditions such as pregnancy, diabetes, varicose veins, recent injury or surgery, and hypertension may be considered either precautionary or contraindicative, depending on the client. Therefore, a medical professional should be consulted before proceeding with self-myofascial rolling. The fitness professional does not have the requirement or qualifications to diagnose a client, so don't be that person. So the following people should just completely avoid foam rolling. Individuals with a skin rash, open wounds, blisters, local tissue, inflammation, bruises or tumors, deep vein thrombosis or osteomyelitis, osteoporosis, hypertension if it's not controlled, cancer or malignancy, bone fracture or of myositis, acute or severe cardiac, liver, or kidney disease, acute infection, whether it's viral or bacterial, fever or contagious condition, neurologic conditions resulting in loss or altered sensation, recent surgery or injury, systemic conditions such as diabetes, bleeding disorders, connective tissue disorders, peripheral vascular insufficiency or disease, medications that thin the blood or alter sensations, direct pressure over face, eyes, arteries, veins, or nerves, chronic pain conditions such as rheumatoid arthritis, direct pressure over surgical site or hardware, pregnancy, direct pressure over bony regions, extreme discomfort or pain felt by the client, or severe scoliosis or spinal deformity. So I know that was a long list of individuals, but I hope that you guys were paying attention and listening, because these individuals should absolutely just altogether avoid self-myofascial release. So especially if you are a fitness trainer or a personal trainer tuning into this podcast right now, I hope you made another note of that to make sure, you can get in big trouble if you proceed without caution. So just be aware of that, people. Now I'm going to explain to you guys some key points for practical application. A self-myofascial rolling program should include a two-step approach. Step 1 is to reduce overall tension. The first intent of self-myofascial rolling is to reduce the overactivity or tension in the targeted muscle. To do this, the user should roll the targeted muscle slowly to identify an uncomfortable spot and hold pressure. During this time, the user should be coached to breathe and relax for between 30 to 60 seconds or until a reduction in discomfort is felt. While holding pressure, the user can apply pressure into the roller, but pain is not the goal. It is more important to relax and breathe than to apply heavy pressure to the point relaxation is no longer possible. As I mentioned in the previous segment, that defeats the purpose. Step 2 is to introduce tissue and tissue movement. Once a reduction in tension has been achieved, the next step is to appeal to the mechanical aspect by introducing active movements. Active movements involve actively moving the targeted limb on the myofascial roller. So, for example, performing knee flexion contraction of the hamstrings while pressure from a myofascial roller was applied to the quadriceps produced greater knee flexion mobility compared to a no knee flexion. Other active movements may include dorsiflexion while rolling the calves, knee extensions while rolling the hamstrings, hip flexion and abduction and adduction while rolling the piriformis, scapular retraction while rolling the pectorals, and shoulder flexion while rolling the latissimus dorsi. While no specific recommendations currently exist, performing 4 to 6 active movements at a medium pace may be easy for the individual to remember and execute effectively. So, if using this rolling method, roll the entire muscle slowly for the desired time. And if an individual is just beginning a rolling program, it may be more important to ensure that they are comfortable rolling before prescribing a complex self-myofascial rolling program. So, I'm now going to be sharing with you guys the length of time for self-myofascial rolling. In a survey of allied health professionals, respondents stated that they most commonly recommended that clients roll for a total of 5 to 10 minutes, rolling each muscle group for between 30 seconds and 2 minutes at a pace of 2 to 5 seconds. A series of studies have supported that self-myofascial rolling for approximately 2 minutes does produce favorable results. Spending at least 90 seconds and no more than 2 minutes on a target muscle may produce the best results. However, there is a lack of research specifically comparing various rolling durations for optimal results. 2 common mistakes made with self-myofascial rolling is 1, allowing the lumbar spine to hyperextend, meaning a lower arched back, and the cervical spine to flex excessively, head falling forward, while rolling in a prone position, and 2, to elevate the shoulders, shoulder shrug, while in a seated position. So I would suggest to coach the client to keep the spine neutral from the pelvis to the skull and shoulders in a safe and relaxed position, and modify as necessary to ensure the client can stay relaxed in a neutral position. So again, the frequency of how many times you should foam roll, most days of the week, unless otherwise specified. You really only need 1 set of foam rolling to do this. You hold areas of discomfort, perform between 4 to 6 repetitions of active movements. Intensity, it should be somewhat discomfort, but you should be able to relax and breathe still. And the duration, this self-myofascial rolling should only take you anywhere between 5 to 10 minutes. Total time, 90 to 120 seconds per muscle group. And you guys, that's going to wrap up today's talk about myofascial rolling. Don't forget to like, share, subscribe, comment, all of that good stuff, because that tremendously helps the show. And I wish you all a very happy, healthy, and successful week ahead. And I'll catch you guys here next week.
You've been listening to the GSMC Fitness Podcast, part of the GSMC Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcasts on Stitcher, Apple Podcasts, SoundCloud, Google Play, and any app where you listen to podcasts. Just type in GSMC to find all of the shows from the GSMC Podcast Network. From movies to music, from sports to entertainment, from business news to weird news, we cover it all. You can also follow us on Twitter and Facebook and listen to these podcasts on YouTube. Thank you, and we hope you have enjoyed today's podcast.